This conference will now be recorded.
Hello, thank you for taking the time to view this webinar regarding the benefits available to you as a full-time employee of Hills Incorporated. My name is Patty Parker and I am with Administrators Advisory Group. We are the insurance brokerage agency who helps Hills annually develop a benefits program for their employees. This recording is for those who are currently about to go through open enrollment beginning September 1st of 2020 for the plan year that runs through August 31st, 2021. And also for those who are newly hired, maybe newly coming on board and going to be eligible soon for benefits. And a lot of the information that we are going to discuss today is available in the benefit booklet that we've created and is available to you in electronic form from Allison at Hills. So if you don't already have that benefit booklet, you may want to reach out to her for a copy of that as well as your election form. And then if you have any questions after you've watched this webinar or during the plan year, our contact information can be found on the last page of that booklet. And so feel free to reach out to us if you have any need for assistance with claims, if you need help finding providers, or you maybe need a new ID card or anything like that, anything that pertains to the benefits there at Hills. You do have a full range of health, dental, vision, short-term and long-term disability, life insurance products, Section 125, and employee assistance programs. So we're going to go through all of these benefits today and review them individually. The medical plans, there are 3 to choose from. Staying with Health First this year, and if you have a copy of the benefit booklet, you'll notice that the 3 plans are laid out side by side for you, so it makes it a little easier to compare them each to the other. All employees do need to complete an open enrollment election form, so make sure you get a copy of that. We'll go through that at the end of the presentation, how to fill that out. But we need to make sure everyone completes one so that we can know whether you're accepting or declining all of the coverages that are available to you. And during open enrollment, this is the time when you want to make any changes necessary for the upcoming plan year. If you want to add or remove dependents or make any changes to your coverage, now is the time to do it, and it would be effective September 1st. Under all 3 medical plans, the preventative care is covered at 100%. And so as long as the visit or the test, whether it's an annual physical wellness exam, if you need a colonoscopy for those over 50, if it's considered preventative, it's going to be covered at 100%. So encourage you to get your wellness visits and testing done annually. First plan, option 1, the HMO Plan 6002. You have primary care visits for a $30 copay for each visit. And then you have a specialist benefit for a $45 copay per visit. We mentioned no referral needed here because there is not a referral in order to see a specialist. If you know that you need to go and see a specialist, just make sure that you see one that is in the provider network and participating under the plan. Prescription coverage, you have a wide range of benefits there for your prescriptions. Preventative medicines are a $0 copay. And then you have your Tier 1, considered preferred generic, at a $2 copay. Tier 2, the non-preferred generic, is a $15 copay. Tier 3, preferred brand, is a $45 copay. Tier 4 at a $90 copay. Tier 5 at a 20% co-insurance. And so it just depends on what medication is being prescribed as to what tier it's going to fall under. You also have mail order option. If there's a prescription that you're taking and filling month after month, you may want to consider utilizing the mail order service. You can have your doctor write the prescription in a 90-day format, submit it to the mail order service, and have your prescriptions mailed directly to you and a 90-day supply for 2 times the copay rather than the full 3-month copay. And so an opportunity to save some money through the mail order. Then at the bottom there, your urgent care benefit is a $75 copay for urgent care visit. Obviously, urgent care is a better option than the emergency room if it's for something that's minor, not life-threatening. But obviously, if it's life-threatening, you want to visit the ER. Your diagnostic labs and x-rays, your labs, so that's your blood work essentially, it's covered at 100%. Your x-rays are going to be subject to your annual deductible. And then once that's met, you would have a 20% coinsurance towards those services. Complex imaging, similar to x-rays, is subject to your deductible and then a 20% coinsurance. So those are things like MRIs, CTs, PET scans, excuse me, those types of imaging services subject to your deductible and then 20% coinsurance. As I mentioned, emergency room is a little bit more costly than an urgent care, so consider urgent care first, but if emergency room is necessary, your first visit in a calendar year will be a $300 copay, and then any visits after that first visit will call for a $500 copay. Your inpatient hospitalization is going to be subject to your annual deductible and coinsurance, and then your outpatient surgery will have a $650 copay each service. Your calendar year deductible on this plan is $1,500 per person and up to $300 for the family if you have dependents on your plan. And as I mentioned, once your calendar year deductible is met, you have a 20% coinsurance for those benefits that call for deductible and coinsurance, as well as all of your copays. You would continue to pay for copays until you reach your max out-of-pocket for the year. That number is $4,500 per person, up to $9,000 for the family if you have dependents on your plan. But your deductible dollars, your coinsurance, and all of your copays are accumulating to this on a calendar year basis. Even though your plan resets in September, these numbers are looked at calendar year and will reset on January 1st of 2021. Your option 1 plan is an in-network only plan. So as I mentioned, you want to make sure that you're utilizing participating providers when looking for services. And then your cost per pay period. This, of course, is the employee portion of the monthly premiums, and it is worked out on a per pay period basis. So employee only is $51.97. If you need to cover yourself and your spouse, it's $184.67. For employee and child or children, regardless of the number of children, it's $132.74 per pay period, and then for the family, $255.82.